In our today's discussion at Medical Sciences, we are going to take you through what we call C-peptide assay or C-peptide test, how it is being utilized in detection and management of diabetes mellitus, which is a metabolic disorder. And as we begin, we always urge you, those who haven't subscribed, please go below the subscription button, make sure you subscribe and hit the notification button. Then you can always recommend this video to many others. So today we bring to you a test which is not commonly being utilized, but is very important in management of diabetes. And that test is called C-peptide test. And about the pathophysiology, so we are going to see how is it produced and what is the significance of this test and when is it indicated and who is supposed to do it. Then afterwards, we are going to look at the interpretation of results, what and the causes of high C-peptide or low C-peptide. So we are going to see that this peptide we are talking about is produced by beta cells. Is produced by beta cells of the pancreas. So we're going to see that the pancreas contains what we call the beta cells. It has the alpha cells, it has the delta cells, and the beta cells. But we see beta cells in the pancreas, they are responsible. So the beta cells in the pancreas, they are responsible for producing both insulin and C-peptide in equal proportion. So they produce insulin and C-peptide in equal proportion, and they are triggered by glucose levels. So we're going to see that the production of insulin and C-peptide in equal proportion, they are produced in response to blood glucose levels. So the higher the glucose levels, the higher the levels of C-peptide and insulin produced. So that's why we can use this test to assess the functioning of the pancreas or to see how your body has ability to produce insulin. That is the test we are talking about today. In that when there is increased glucose levels or the glucose levels increase, it goes and stimulates beta cells of the pancreas. And these beta cells of the pancreas are stimulated to produce what we call proinsulin. And this proinsulin, after being produced in response to high glucose levels or increase in glucose levels, the beta cells produce proinsulin in the nucleus, which then moves to the rough endoplasmic reticulum and the Golgi apparatus and is split into equal proportions. So this proinsulin produces insulin hormone. It gives rise to insulin hormone and C-peptide in equal proportions. So these ones are produced in equal proportions. So the proinsulin is split into two, C-peptide and insulin. So meaning when you have one insulin, you have one peptide. If you have 10 insulin molecules in the blood, it means you have 10 C-peptide molecules. So meaning whenever we find a C-peptide, we also think or we are assured that there is insulin because they are produced in equal proportions from the beta cells in response to increase in glucose levels. So this one makes it a beta test. And why do we determine C-peptide, not insulin levels? Why should we determine C-peptide, not insulin? Or because we can also do insulin test. But why we prefer C-peptide is that this one, it has a long half-life, or it stays long after being produced. Its duration in blood is longer and it is not affected by the state of food, or maybe it's not affected by the hepatic metabolism that is in the liver. And another thing, this C-peptide is not, why we don't prefer insulin is that insulin can be even those, especially the type 1 patient who would be taking insulin injection that is exogenous. So when you do insulin assay, you might not be sure if the insulin I have got is either from the beta cells or it is from exogenous injection. Whereas C-peptide is purely endogenous. This one is purely endogenous. So it gives us the right clue. So it is very sensitive than insulin assay. So after knowing how C-peptide is produced, we need to know the significance. Why should we? What is the significance behind doing C-peptide? Why should we do, and who is supposed to do this test? Because we have seen it is better than determining insulin in the body. And one of the indications of this test is we are able to predict a risk of developing type 2. Because as we have seen, is that insulin and C-peptide are not just produced by the body. They are produced in response to glucose. So meaning, if I do a C-peptide assay, I find C-peptide is high, it tells me that even glucose is getting high. So I can be able to predict a risk of developing type 2, especially in obese patients, before even it starts. So it can be an early indicator of developing type 2 diabetes. That is one. So we can use it to predict the risk of developing type 2 diabetes. That is one of the significance of this test. So whenever you see there is increase in weight, you are becoming obese, you can always monitor your C-peptide levels. And those C-peptide levels, the more they are being produced, it tells us that also your glucose is increasing, though diabetes has not come in. Then another significance that we can see under this test is we can use it for classifying or to differentiate. We can use it to differentiate type 1 and type 2 diabetes. And how do we do it? We know that with this level in type 1 is due to the destruction of beta cells. So meaning in type 1, the C-peptide levels are going to be low. It is going to be low. Whereas in type 2 diabetes is due to insulin resistance. Insulin is much in blood, but the cells are not responding to this insulin. So a high level of C-peptide indicates type 2 diabetes. So we can use this C-peptide to confirm either if the patient has type 1 or if the patient has type 2 diabetes mellitus. Then another significance of this test, we can also use it. We can use this test as a marker to identify or to know the cause of hypoglycemia. So if someone is having low blood sugar levels and we are not sure of the cause of hypoglycemia, maybe we are suspecting it might be due to increase in insulin to people who have tumor of the pancreas called the insulinomas. So if we want to see the cause of hypoglycemia is maybe due to increase in insulin levels, we can do C-peptide. And when we find C-peptide is high, we can be sure that the cause is either the tumor of the pancreas. So we can also use it for diagnosis of insulinoma, presence of the tumor of the pancreas that affect beta cells to produce high levels of insulin, which is indicated by high levels of C peptide. And another thing, which is the last indication or significance, is we can do this C peptide assay to predict or to monitor if the treatment of diabetes is working, or to know when to give insulin and when not to give it. For example, people with type 2 diabetes, when it becomes chronic, there is always decrease in insulin. How does it come about? This decrease in insulin is that when insulin goes high in type 2 diabetes, it has the ability to become toxic, or it exerts the inhibition on beta cells. So you'll find increased levels of insulin can go and can exert inhibitory effect on beta cells. So at the long run, patients with type 2, they can end up having insulin deficiency due to inhibition by increased blood insulin. So at the long run, you find there is decrease in insulin. So this test can help us to know when to give insulin, exogenous insulin, in patients with type 2 diabetes, in the case of insulin toxicity that inhibits production of beta cell insulin. So these are the significance of them, whereby we have seen we can use to predict the risk of developing type 2 diabetes. We can use it to distinguish between type 1 and type 2 diabetes. And we can go ahead to ascertain or to confirm if the cause of hypoglycemia, that is low levels of blood sugar, is maybe due to high insulin levels, especially seen in the tumor of the pancreas that affect production of insulin from beta cells. Then lastly, we have seen we can also use it as a treatment marker to know the treatment plan in type 2 diabetes, to know when should we give insulin in case of insulin insufficient. So those are the predicting values. And what are the reference range? And before we look at the reference range, we need to know the type of sample used. So in the lab, we prefer either fasting blood sample. This patient should have fasted between 8 to 10 hours, or we can use 24-hour urine, because the C-peptide, when produced, it is excreted via the kidney in urine. So we can use either 24-hour urine or fasting blood to determine C-peptide. And we are saying the reference range of this test is between 0.5 to 2.0 nanogram per ml. But this is not standard. The reference range can differ from one manufacturer to the other, or from different labs. So others can be maybe between 0.8 to 3.8. So they can easily be difference. And we're going to see that in result interpretation, this test, it is not advisable to do it as a standalone test. It is advisable to do it together with the glucose levels. So if I determine a C-peptide as levels, I should go ahead and I also do glucose levels so that I can be able to compare. And we can say that if we find this is C-peptide results and we have glucose results, you find C-peptide levels are high and the glucose levels are also high. It means by feedback, the cause of high levels of C-peptide is due to high levels of glucose. So here the beta cell is functioning well, meaning there is no problem with the beta cells, but the problem is with high levels of glucose. And this one can be seen in type 2. This one can confirm type 2 diabetes. Why? We are seeing if there is enough insulin, why is glucose remaining high in blood? It means the cells have resisted the response of insulin, because we say the C-peptide and insulin are always in equal proportion. So this one can confirm to you that this person has type 2 diabetes. And what if we do C-peptide assay, we find it is high, and here glucose levels are low. This one is high, and this one is low. This one can tell us if glucose levels are low, we expect also C-peptide to be low. So when we find there is high C-peptide, and yet we know that glucose is the one that stimulates its production, it means there is a problem with the beta cells. Either there is a tumor affecting beta cells, and this condition can be hyperinsulinemia caused by the insulinoma, the tumor of the pancreas that causes the beta cells to produce much insulin. And when I do the assay, I find there is low C-peptide and there is high glucose levels. The glucose levels is high. This one, high glucose levels should stimulate the beta cells to produce C-peptide and insulin. So by the time C-peptide is low, it means also insulin is low. And this one indicates there is destruction. It means the beta cells are destroyed by either autoimmune, whereby there is production of autoantibodies that are destroying the beta cells. So this one can confirm type 1 diabetes mellitus. So this is how we can use them to interpret the results. And as we are winding up with this video, we are going to tell you that high levels or high C-peptide results are seen in conditions, like type 2 diabetes mellitus. We can see it in insulinomas, that is the tumor of the pancreas. We can see elevated levels of C-peptide in renal failure. We can also see it in Cushing's syndrome. So these are some of the conditions where C-peptide can be high. And we can see low C-peptide levels. Low C-peptide levels can be seen. This is causes of high. Then low C-peptide levels are seen in conditions like type 1 diabetes mellitus, which is due to lack of insulin. We can see it in liver failure. We can see it in severe infections. We can see it in Addison's disease. All these ones can cause low C-peptide levels. And we can also see it in conditions whereby someone has been on taking increased levels of insulin, exogenous insulin, especially those with type 1, whereby they have taken excessive treatment of insulin. It can lead to low production, because when there is increased treatment with this, it can lead to low insulin levels, which affects also the C-peptide levels. And even sometimes on high levels, we can see hypokalemia causing it, low levels of potassium in the body. So these are some of the causes of high C-peptide and low C-peptide levels. But the main significance is to distinguish type 1 and type 2, then also predicting the risk of developing type 2 diabetes, and also ruling out insulinomas and ascertaining the cause of hypoglycemia in hypoglycemic patients who have low levels of glucose. Hope this video has benefited you, and if you have liked this video, please thumbs up. Like this video by switching on the like button so that you can also continue to share with many others. And may the good Lord continue to bless you.